Good evening. My name is Gabriella Leon, and I am choosing to do my presentation on Huntington's disease, Korea. Um, I am choosing this disease personally because I want to cause awareness to a lot of people out there and a lot of people in the medical field because surprisingly, it's not well known. My grandmother personally passed away from it 2 years ago, and I have two uncles that tested positive for it and about five cousins that tested positive for it. My mother personally has never been tested positive for it. She's also never done the testing. She is 55 years old, living a healthy life, working her butt off. And I personally haven't done it just because I'm living life. I'm doing me. But a little over a month ago, I was given the choice to get my 9-year-old son tested for it due to seizure complications. So with those seizure complications, my son was having seizures. First, they had started out with febrile seizures, and then now they're afebrile seizures. So febrile seizures are with fevers. Afebrile seizures are without fevers. So now he's having them without fevers, but they are brought on by pain, and they have stumped my neurologist for my son. He's done MRIs, he's done CAT scans, he's done brainwave testing at home and in the office, and they just don't know what it is. But when he gets hurt, he goes into a seizure. So this has made him a candidate to be tested for Huntington's disease. It's been a little over a month since we've done the testing. So far, the neurologist hasn't been concerned, but since that's the case, I decided to take this presentation as an opportunity to get to know more about it. Whether it comes back positive or not, I'll know more about it and I'll feel better about spreading awareness. So with that being said, that's my little background on why I chose this disease. I'm going to get started and tell you a little bit more about it. So what is Huntington's disease? Huntington's disease is a neurodegenerative disease that is inherited. It's not something you can just pass around, and it's not something you can give from one person. It's not sexually transmitted. It is inherited. A neurodegenerative disease is the progressive loss of structure or function of neurons, which involves cell death. So with that being said, when our neurons die off, they do not replace themselves. They do not heal themselves. They do not, what we have in neurons is what we get. And unfortunately, that is a problem in the Huntington's disease community. These kind of diseases usually take place in the brain, and the damage is irreversible and incurable. Like I was saying, it's not something that can be reversible, and it's not curable at the moment. To break it down, the brain slowly dies off in many areas, causing loss of functions, communication, speech, and any other damage caused from the dead brain cells in certain areas. So it all depends on where these dead cells are dying off. It all depends on where they're being affected. It can be in totally different areas. It could be in the temporal, occipital, anywhere, parietal. And those certain areas have certain functions where we communicate, where we have movement functions, where we memorize certain things, where we know how to speak and know how to swallow. And a lot of these things are affected by these brain loss. So there's a brief history of Huntington's. There is not much study on Huntington's, and there's not much of a background. So this one was really, really hard to get. It took me literally almost this whole semester to put together the little information that I have, because not many people know about this. There's not many studies on this information. There's not many, there's not too many people looking into information like this when there should be more, because the Huntington's disease community is growing. So the earliest known case of Huntington's disease was in 1841 by American physician Charles Oscar Waters. The condition was later described in further details in 1972 by another American physician, George Huntington. And obviously that's where we got our name for the Huntington's disease. Even though it was discovered in the late 1800s, it didn't start to come to awareness until 1960s. And even now, it's not in huge awareness like cancer is or Alzheimer's and bigger diseases, but this is a pretty big one too. Research at the moment include medication development to treat symptoms and to try to slow the progression of the disease. Um, and at the moment, there's none. There's nothing they haven't came up with nothing. They're stumped. They're in a standby right now. They're wondering what they can do to help the Huntington's disease community. Also, studies of stem cell therapy with the goal of replacing damaged or lost neurons have been the main focus. With that being said, stem cell therapy is a big one. Stem cells can, as a lot of people know, mimic so many different cells, functioning cells, heart tissue cells, kidney tissue cells, what else? Like any kind of cells you can think of, muscle cells, they can mimic it, and they're trying to get it to mimic neurons. They're trying to get them to mimic these cells so we can maybe replace these cells in the Huntington's disease community patients, replace them and pretty much heal them. That's something that would be big for Huntington's disease patients because stem cell therapy can do that if they are able to figure out how. So symptoms of Huntington's, problems with motor skills, mood swings, and mental abilities all come into place with the loss of these functions. When we have loss in our emotional part of the brain, we lose these parts of being able to be ourselves. We lose the state of who we are, memory, we lose memory, not being able to understand why we act. Aggression is a big one. They get very aggressive because the anger of not understanding why you're acting this way when you were perfectly fine years or months ago, and now it's like you don't know how to control your emotions can be very frustrating for Huntington's disease patients. It is also a basal ganglia disease causing hyperkinetic movement disorder, which is known as the chorea portion. Not all Huntington's disease patients get to experience the chorea portion, but a lot of them do, but some are very fortunate not to. The disease also advances uncoordinated involuntary movements of chorea are presented, and eventually movements worsen, causing the person to be unable to speak. And this again comes into where these cells are dying off. So if they're dying off where our speech is, or where we have that voluntary swallowing, we don't know how to do it no more. We pretty much forget how to do it. And it's not forgetting, it's just our brain doesn't have that memory no more because those neurons are dead. So with that being said, that's where these symptoms come from. So who can have Huntington's? Who can have Huntington's? Huntington's isn't something that you can just spread around. It's not something that you can just get from your friend spending the night or catch from someone from, a sexually transmitted disease. It is actually an inherited disease. It's passed down from family members, unfortunately. Someone can be a carrier and show absolutely no symptoms, but can still pass it down, or someone can have the gene and develop symptoms. When someone is positive for Huntington's, their offsprings have a 50-50 chance of inheriting the disease. So every child that they have a 50-50 chance. Their first child can have it, be positive. Their second child can be negative, or their first child can be negative. Their second child can have it. So every child is given that 50-50 chance. It's not much, but it's big for our community because it's a 50-50 chance, a 50 chance of having it, a 50 chance of not having it. And we hold on to that dearly. If the offspring is tested negative, the gene does not continue and it does not skip generations. Yes, that's what they were looking for, because it's like the skipping of generations is scary, but it does not skip and it does not continue, and that's where it ends. And there's a 50% hope in not having the disease and not passing it on, but also a 50 chance of also inheriting the disease and continuing it. And this is where this community is growing. Compared to the 1980s, this disease has grown so much because not a lot of people are aware of this disease. So it's like if it runs in your family, like for example, me, I had no idea my grandmother had this, and then having kids and kids and kids and not educating yourself on this, you can potentially pass this on, and this community grows even bigger. And then it's like, it's kind of like the awareness gets a little bit bigger, but then again, you think about it, it's like, we honestly don't want to keep passing this on, we don't want to keep giving, these innocent children these diseases and this potential life of not understanding what's going on. But that's pretty much how this is spreading and the community is growing. Complications from Huntington's is pneumonia, heart disease, physical injury from falls, and suicide. So pneumonia and heart disease come from the part of, when we start losing functioning organs, um, from the neurons dying off and not being able to communicate between them. And the physical injury from falls, is from the chorea part, when there's these uncoordinated movements and these sudden movements given off, by these involuntary movements, and they fall. They can hit their head, cause trauma to their head, and unfortunately bleed out and die eventually. Suicide is one that I definitely want to cause a big awareness to. Suicide is huge in the Huntington's disease community. Suicide is something that comes with the whole mental ability and the mental state, not being able to be themselves and not understanding why, or even knowing why, and not getting that idea that, like, we won't be ourselves. You know what I'm saying? Like, we one day are completely fine, and then a year later just not understanding why we're so angry, or why we're not understanding like we did before, or our memories just completely escaped us, or not being able to move, the frustration of being stuck in your body and not being able to make those movements or those decisions that you were before. It can definitely be a downer, and these downers cause a lot of the community to commit suicide. As I mentioned before, a couple of my uncles have tested positive, and actually one of them decided to take his life 3 years ago because he didn't want to put his family through the situation. And I like to speak of this because it's causing awareness. It's helping those out there that do feel that feeling lost. You're not lost. You're not alone. There's so many of us out there that a lot of people don't know about. Onset and prognosis. The usual onset for Huntington's disease is from ages 30 to 50 years old. 30 to 50, those are so young, so young. There are some special cases where Huntington's disease can develop earlier. In these cases, it's called juvenile Huntington's disease and affects 8% of cases before the age of 20. A lot of these children do not see the age of 20. A lot of these children don't even see their teenage years. And these children, it's finding a lot of studies that these children are actually developing these genes from a father that's positive with Huntington's disease. For now, that's what they're kind of going off of, because they don't have enough information or enough studies to know if it comes from the mother, but more than 99% of these juvenile Huntington's disease are coming from the father's genes. And if it does come from the mother, eventually they will put that in there, but for now it is coming from the father's genes. The prognosis of Huntington's is about 15 to 20 years from onset of symptoms. A huge chunk of the Huntington's community experience suicide due to mood change and mental health. And that's what we're talking about before. And that's why the prognosis is 15 to 20 years, because a lot of these people decide to choose to take their lives. Treatment and medication. At the moment, Huntington's is incurable, so treatment involves supportive care and mental health support. Again, without the mental health support and the supportive care, these people fall through the cracks and don't get the help that they need, and eventually just end up in states of minds that are imaginable. Medication that is taken at the moment is called tetrabenazine, which is a drug for the symptomatic treatment of hyperkinetic movement disorder. So at the moment, no medication has been developed to slow or stop the progression of the disease. So this medication, the tetrabenazine, is only for the movement. It's to subside the movement and to pretty much, it's not so crazy, it's not completely uncontrollable, but that's pretty much all the medication that they have at the moment to help with Huntington's disease. So there are many possible ways of diagnosis. One of them is testing for Huntington's disease includes questions, a general physical exam, a review of family medical history, a neurological and a psychiatric examinations. Neurologists would conduct tests to check your memory, reasoning, mental agility, language skills, and spatial reasoning. A psychiatrist would evaluate emotional state, patterns of behavior, quality of judgment, coping skills, signs of disordered thinking, evidence of substance abuse. Evidence of substance abuse is another huge one. When someone shows that they have been using any kind of drug, it actually progresses Huntington's disease. It progresses the brain, the neurons in the brain die off a lot faster than they would if they weren't using drugs. And they notice this, and they notice a lot of the Huntington's disease patients result in taking drugs because it helps them feel better, and it pretty much kind of like hides them from the Huntington's disease. And they're pretty much wrong, because in this situation, it's making it worse for them. They're dying off sooner, or they're committing suicide, or their symptoms are worsening. And evidence of substance abuse is a big one for Huntington's disease community. Brain imaging over different periods of time is also blood testing can give a positive or negative result. So the brain imaging over different periods of time, we can do between months, between years, depending on the progression of the time. It can change over time, but it shows where the brain's dying off. It shows where it's dying off and how it's dying off, the certain areas it's dying off. So it gives these doctors more clarity on why you're acting this way, or why you're losing the ability to move, walk, talk, swallow. And it's showing where the disease has taken place and spreading. Epinology. Okay, so epinology was really hard for this one because there is not much study of this background at all. So what I was able to find was a few estimates of Huntington's disease epinology in the US that exist. And one study had estimated in 1989 to the 1990s incidence and prevalence in a single US state as 0.3 and 1.9 per 100,000 people. That's not much, thankfully. And then a recent study of commercially insured patients calculated incidence and prevalence at 1.2 and 6.5 per 100,000 people, respectively. That's jumped up a lot. But between the 1989 to the 1990s to now, a recent study, this is done in the maybe about 2019, 2018. That's a big jump. That's a huge jump. And it's showing how much this community is growing, how much more it's growing. And like I explained before, it's growing so much faster because people are having more children. Who doesn't want kids? But it's like they're having children not knowing what they could possibly pass down. So famous people known to have HD, there's not many at all. Only one I was able to find was an old folk singer named Woody Guthrie, and he was the only known famous person with Huntington's disease. He had passed away in 1967 at the age of 55. So at the time, there was no studies of Huntington's disease, and they had no idea really what was going on with him. Also, a Ducks football coach named Mark Helfrich has a mother suffering from the disease, but he fails to answer if he is positive for the disease at all. But I also just wanted to add in there that there's a lot of the people like that in the community that fail to get tested, like myself, and choose to live their life not knowing. It's best to know, but sometimes you just don't want to go through that mental disabling pretty much. So I understand where he's coming from, but that's why I like to mention him, because there's a lot of him in the community that would rather just live life and go on and see where it takes us pretty much. So this is my citation and the places that we can find more information on Huntington's disease. I like to share this because it's good information, not just for me, but for anybody wanting to learn. This information is good for people that also have Alzheimer's or any other type of brain deteriorating diseases, because when we bring awareness, we bring funding and we bring more information and people willing to help and support those that are going through these hard times. And one of them that was big was the Huntington's Disease Society of America. They are huge, and there's a lot of people. There's so many families bringing awareness and using things like TikTok and YouTube and Instagram and big platforms to spread awareness. And it's really important because the more funding we get to do these studies and these stem cell studies is really important, because that kind of stuff is not cheap, and getting that kind of funding gets that awareness out there and gets us to do more studies. And the moment that they're able to get that stem cell pretty much down for neurons, would be an amazing day for not just Huntington's disease patients, but Alzheimer's patients, any type of brain deteriorating patients. So with that being said, I really hope that this brings awareness to you and to the other students in the class. And I hope this shows, gives you initiative to look for more information and to want to go out there. So with that being said, thank you for listening to my presentation. I hope you really enjoyed it. And I hope this causes awareness.